Okay, welcome everyone to our webinar today on the human rights of older persons, the social costs of ageism. We're pleased to have everyone joining us today for this special webinar. We are pleased that we actually have a few special guests that are joining us today, which will be introduced in a moment. Just to go through some basic logistics for the webinar. So everyone will be muted during the presentation through the session. We will have a question and answer near the end of the presentation. So please feel free to type in your questions in the question box. If you have some comments that you'd like to make or links to reports, which we'll be posting during the webinar, you can put that in the chat box. We are joined with our ASL interpreters today, who are joining us, and will be switching on their screens on and off during the presentation as well. So again, just if you want to make the images larger, you can pull the screen to the left, and that will adjust the screen to be larger on your screen. We will be asking for you to complete a short evaluation at the end of the session. It just gives us feedback on how the webinar was, and your information or updates, or sorry, your feedback on further presentations for the future when we start planning additional events, looking at the issues around elder abuse, the rights of older adults, and any of your input we really do take into consideration when we're planning these future sessions. So before we begin, I would like to give our land acknowledgement. So we acknowledge that the lands we live and work on are the traditional territories of many nations and home of many Indigenous people. There is a new understanding of our interactions and engagements with this land and its people, and we endeavor to honor them by strengthening our relationship and responsibilities towards them. While there is important work being done by many nations and allies to ensure the continued thriving of our communities and knowledge systems, we recognize that our knowledge and way of doing things may not be the priority as we work towards safe, abuse-free Ontario for seniors. So for those who are just joining us, just to go over the presentation overview, today we have a number of speakers who are talking on different issues around the human rights of older adults. And so we'll be talking about healthcare and mental health. We'll be talking about access to information to technology, discrimination in the workplace, and then ageism and human rights in the era of COVID. And at the end, as I indicated, we will be talking about doing a question and answer. So you can pose those questions throughout the session, and we will keep track of those. And so please feel free to post your questions during the seminar today. So just a little bit about our organization. So Elder Abuse Ontario, Prevention Ontario envisions a community and a province where seniors are safe and feel respected and treated with dignity. And we do that through raising awareness, delivering training, and coordinating our services across the province to ensure the health and safety and well-being of older adults. And we work with many community partners and agencies within this capacity, not only within Ontario, but also across Canada and across borders, to ensure that we have a robust information and resources that we can provide to our members in our community that we work with, and those that are seeking information, particularly seniors and caregivers as well. So I'm just going to turn it over to my colleague Benedict, who will be introducing her organization and the speakers.
Have a very exciting lineup. I will introduce everyone very briefly. We also had a slight change. We were supposed to have Martine Lagacé with us today, who could not make it, but we also have two new guests who are joining us, especially for the day that, and it's quite a perfect timing. So I'll start with them. Welcome Elena Officer, who works for the World Health Organization in the Demographic Change and Healthy Aging Unit, and Banya de la Fuente Núñez, who is also a Technical Officer for Demographic Change and Healthy Aging Unit with the World Health Organization. So both of them today are here. We're very lucky because the World Health Organization just released a brand new report on ageism this morning, just a few hours ago, and they'll be here to talk about it. But before we get to that, I'll present our other panelists. So we have Dr. Karen Ribeiro, who is a geriatric psychiatrist and the board chair and founding board member of the International Longevity Center and the chair of the Global Alliance for the Rights of Older People. We have Liat Ayalon, who is joining us from Israel today, from Bar Ilan University. Margaret Young, whom you may remember as well from our webinar in December, who is the founder of Age Noble and also a member of the Global Alliance for the Rights of Older People. And our closer today, Margaret Gillis, who is the president of the International Longevity Center Canada. So it's quite the stellar panel. I'm very excited to have you all today.
Let me just quickly say something about you. So Elena is a native of New Zealand, and she started her career in Australia before holding different positions working on disability, health, and development in many continents, including Africa, Europe, Asia, Middle East, and Western Pacific. Elena is the unit head of the Demographic Change and Healthy Aging Unit at the WHO, where she coordinates the Decade of Healthy Aging and oversees the organization work on age-friendly environments, including the Global Network on Age-Friendly Cities and Communities, and the development of global campaign to combat ageism. Prior to this position, she was the coordinator for the Disability and Rehabilitation team at WHO. She holds a diploma in health science, a master's degree in applied science, and a master's degree in public health. And I had the pleasure of hearing her as being part of the big launch this morning on ageism, on the WHO program on ageism. We're so lucky to have you and Banya here today, for which we thank you immensely. The floor is yours, Elena.
Thank you so much, Kieran and everyone. It's an incredible privilege, actually, to be invited. I realize we're dropping in at the last minute, but it's really a wonderful opportunity for us to share the first UN Global Report on Ageism. So I'm going to share my slides. It says, because you're sharing, I'm not able to. So then I will share here. So what I was hoping to do, because I realized they're a great lineup, so I don't want to take too much time, but I would like to just give you maybe a quick overview of the main messages from the Global Report on Ageism that we launched this morning. So it is a joint UN report for the World Health Organization, the Office of the Commission of Human Rights, the Department of Economic and Social Affairs, and the UN Population Fund. And what the report does is outlines, and I'm going to, what is ageism? So it refers to ageism as how we think, so stereotypes, how we feel, prejudice, and how we act, discrimination, towards others or ourselves based on age. And for the first time ever, the report provides some global prevalence data on ageism. And the report indicates that 1 in 2 people around the world, so half of the population globally, are ageist towards older people. And the evidence indicates that people are more likely to be ageist towards older people if they are in fact young, male, fearful of death, and less educated. You're more likely to experience ageism as an older person if you're older, if you're care dependent, or if you live in a country that actually has a lower healthy life expectancy. The report actually addresses ageism across the life course, so ageism against younger and against older people. Unfortunately, we don't have the same level of data on younger people. So in Europe, which is really the only region for which we have data on all age groups, younger people report experiencing discrimination more frequently than other age groups. And who's targeted as a younger person? Being female means that you're more likely to be a target of ageism against younger people. The report outlines in great detail just how harmful and costly ageism is. It has far-reaching impacts on our health, physical and mental health, including the onset of dementia, earlier death, social isolation and loneliness, the fact that if we're more ageist, more likely to take health risks, such as eating an unhealthy diet, smoking or excessive use of alcohol, and poorer quality of life. But the report outlines that it's not just about the individuals, it's also about our society that then devalues, as a result of ageism, the abilities of older people and younger people to contribute, eroding intergenerational solidarity, and has really significant economic costs to our societies. So incredibly harmful, and also directly, but also exacerbates other forms of disadvantage like disability, sex, and race. But the overarching message of the report, which is great, is that it's very optimistic. There are 3 evidence-based strategies that actually work in preventing and reducing the impacts of ageism. That's policy and law, educational activities, and intergenerational interventions. We know that policy and law can address discrimination and inequality on the basis of age and protect the human rights of people of all ages. Educational activities really work in enhancing empathy and dispelling misconceptions around different age groups. And the intergenerational interventions, which bring different generations together, can really help reduce the intergroup prejudice and stereotypes. The report indicates that if we can implement those 3 strategies together, we're much more likely to have a better impact. So the report finishes with 3 main recommendations. Invest in these 3 evidence-based strategies. They are what works. Improve the data and research to gain a better understanding of ageism and how to reduce it, particularly in low and middle income countries, but also more evidence on those interventions and other promising interventions which are outlined in the report. And we really need to build a movement to change the narrative. So the report to conclude is that ageism affects people of all ages. It's incredibly prevalent. It is everywhere, in our healthcare, in our social care, in our workplaces. It is very harmful, but it can be combated. So that's a very quick summary, but I do encourage you to read the report, and I'll pass over to Bania to learn more about the other tools that we have that can support you in using the report.
Thank you so much, Elena. I'm very grateful to you for being here today. And I hope that everybody has a chance to not only read the report, but actually to implement some of the recommendations that you and your colleagues have put together so thoughtfully in the report. I'll just take a minute and quickly introduce Bania more formally. So Bania is originally from Spain. She's one of the 2 lead authors of the Global Report on Ageism and manages the global campaign to combat ageism at the World WHO. Bania drives capacity building efforts on aging in countries and regions. In this capacity, she has led the development and the delivery of the first Leaders Program on Healthy Aging. Bania is a colleague of mine, a physician, who first joined WHO in 2014 and has worked with many different NGOs and research institutes in both high and low and middle income countries. Bania has very well qualified with a medical degree, a master's degree in philosophy, politics, and economics of health, and is now completing a degree in social and cultural anthropology. More paper, that's great. Without further ado, Bania, you've got the floor.
Thank you very much for having me here. I'm just gonna quickly share my screen, hoping that you can all see it. Is that okay for everyone?
Perfect, yeah.
Great. So just following from what Alana was mentioning earlier. So today we did launch the first ever UN Global Report on Ageism, which we really hope will set the agenda moving forward. But what we were trying to do today, beyond launching the report, is to really kick off a global conversation about ageism. And we didn't want, of course, the conversation to end during the event today. We wanted that conversation to continue beyond the event. And I think even joining the event, this event right now is proof that we can continue the conversation on an ongoing basis. And I'm really, really happy to be here. We want these conversations to take place in your homes with your family and friends. We want these conversations to take place in the workplace among our colleagues. We also want teachers to take up the conversations with their students. And to really help keep this conversation alive and to provide you with tools that you can use to do that, we have developed a very comprehensive toolkit that you will be happy to hear is available not only in English, but also in French and Spanish. And it includes a wide variety of resources that range from conversation guides, like you can see on the screen, which provide key guiding questions that you can use really to spark these discussions with whomever you wish to have them and just to have them everywhere. The toolkit also provides an event guide that can help you prepare and organize events on ageism. It also includes a slide deck, and I noticed that there were some questions before about whether you could access the slides. You have them readily available already on our website. The toolkit also includes infographics that summarize the key findings of the global report on ageism that we launched today, as well as a social media guide that provides a very wide range of different assets that you can use across social media platforms using the hashtag #AWorldForAllAges so that we can really spread the word out there. Beyond the social media tiles that you see on the screen, the social media guide also has interactive stickers and even an Instagram filter that we encourage you to use, not only so that you can try it out, but also so that you can encourage those conversations with your friends and your family and challenge everyone's attitudes towards age and aging as you're having those conversations. What I'm presenting here is just a preview of the toolkit, but as I just mentioned, the toolkit is already available on our website, and I'm sure it will be posted already or today here in the Q&A or the chat, so that you can go ahead and start using it. Beyond the conversation, I guess, and the launch that we had today and this conversation that we're having now, the WHO is also organizing a Facebook Live next Thursday on the 25th of March at 3 p.m. CET time. And in this Facebook Live, we really hope to be able to answer your questions live. So any other questions that you may have on ageism, and to really, as I was mentioning, help maintain the conversation throughout the entire year and moving forward. We won't be able to tackle ageism unless we're all in it together and unless we continue to have these conversations wherever we are and with everyone we may be with. So thank you very much for your attention, and I hope you enjoy the toolkit and the other resources that we have developed.
Thank you so much. Really appreciate it, Banya. And I understand you both have to leave soon. Is that correct? Yes. Will you be able to stay for a little bit longer, Banya, or are you?
I can stay for 10 more minutes. 10
more minutes, okay. So
I'm going to have to go, Karen.
Yeah.
I have another meeting.
Okay, Elena. On behalf of our entire planning committee and everyone on the call, thank you both very, very much.
Thank you. It's a real pleasure. Take care.
Look forward to working with you.
Sorry, I can't listen to the other speakers. Bye.
It's okay. Bye. Thank you. Okay. So without further ado, I'd like to call upon Liat. So Liat Alon is a friend and a colleague, and she's joining us today from Israel. And her talk today is on ageism and human rights at the times of the pandemic. Liat?
So, hi everyone. Thank you for inviting me. I'm thrilled to be here today. And I will be talking, as I said, about ageism and human rights during the pandemic. I will start by saying that this has been an ageist virus because certainly it does distinguish people based on age. And I think that with this fact in mind, there's been a lot of communication around older people as being vulnerable and weak, and also a burden to a healthcare system that has been neglected worldwide. This initial communication about older people as vulnerable and a burden has really instigated generations pitting against each other, and also a disregard towards the impact the pandemic had on younger people, at least in the initial stages, and also disregard to instructions among some groups of the population who thought that this is really not their disease, not their problem. I probably could have talked about any of these issues that you see here on the screen, any of the measures or communications that have taken place during the pandemic. I will be focused primarily on long-term care measures that have been taken place pretty much worldwide, and also on the vaccination and how they are related to ageism and also to human rights violations. And basically, with regard to long-term care settings, it became very early during the pandemic that these settings and the residents who live in these settings actually end up being at a high risk for COVID related disease, death, or infections, both because of the characteristics of the residents themselves and because of the structural characteristics of long-term care settings. This resulted in residents of long-term care settings being locked in their rooms or residential units for months in a variety of countries around the world, in stories about residents being abandoned by their care workers, about bodies of residents being hidden for days, and the neglect of the long-term care systems worldwide has become apparent because these settings had to deal with limited workforce and limited person protective equipment. I will be describing here today some findings from a research that we conducted in Israel, actually in community care retirement communities. And these settings are a little different because on the one hand, these are institutions, but on the other hand, the residents who live in CCRCs are independent. And all in all, these settings have tried to foster a very high level of autonomy and independence in these residents. Nonetheless, during the early stages of the pandemic, these residents were confined to their units for months. We interviewed them and we identified a couple of themes that repeated in these interviews. The first one was a rupture that described their life before the pandemic, that was described as ideal, versus life after the pandemic, that described as a loss of power and a very strong sense of power imbalance. And as one of the residents said, she felt as if she lives in a cage. It's a cage of gold because these settings are actually quite fancy, but it's still a cage. And many of them stated that they felt as if they live in solitary confinement. The residents also noticed major power imbalance that was not evident before the pandemic. But basically, once the pandemic took place, they noticed the fact that the staff had all the knowledge about the pandemic and how to manage it, and they were deprived of their own free will. I think the most notable finding was the traumatic effect this had on the residents. And many of these residents have already experienced past traumas before. This is a quote from a resident who actually was a Holocaust survivor. And she describes here how this pandemic took her back to when she was 7 or 8 years old, all alone as a child Holocaust survivor amongst strangers. And many of the residents really had many parallels between their experiences during the pandemic and their past experiences in the Holocaust and in other traumas. The conclusions are that really CCRCs were successful in physically protecting older people, at least in Israel. But these residents had to pay a price, and it really impaired their well-being and mental health. CCRC's defense mechanism were successful to some extent, but in the end, actually, they really collapsed, and many reported high levels of anxiety, depression, and despair. When we interviewed family members of residents in long-term care settings, in nursing homes and in CCRCs as well, we identified a couple of themes. The first one was really a rupture between their life before, when there was a connection, a physical connection with family members, and life after the pandemic, when this connection was gone, there was also the disruption of routine treatment that was really substantial and resulted in the physical impairment and emotional impairment of many of the residents, especially the ones who were already frail even before the pandemic. These family members reported an abrupt decline in their satisfaction and trust in these settings. Many of them try to have an active voice and to make a change by communicating with staff and try to influence the care of their loved ones. Nonetheless, they also were highly ambivalent, both in relation to whether or not they should be keeping their loved ones in an institution that confines the residents to their rooms, and also in relation to the best response they should be considering with regard to the extreme situation at hand. The recommendations that these family members made was that management and staff actually play a major role in the life of residents and also of family members, and more transparent and flexible measures are really appreciated and improve the mental health of both residents and family members. I'm going to briefly discuss now a different study that was conducted actually in the United States. And here we analyzed newspapers articles that discussed the issue of nursing homes in the United States during the pandemic. What we found was actually quite parallel to the finding in Israel. In the newspapers, residents' voices were completely excluded and superseded by others. There were a lot of elements of shock, of deception, of fear that these newspaper articles tried to create in the reader. And there was a blame game, depending on the political take of the particular newspaper. We concluded that these newspapers really depicted a cultural model of panic and dishonesty that shapes our entire discourse around nursing homes nowadays. And this depiction of vulnerability and the illusion of resident inclusion in the news coverage really allows for very paternalistic decision-making and care practices in the name of protecting and benefiting older people. I'm going to end with some findings related to the issue of vaccination. And here, I think, in contrast with other steps that governments had to take during the pandemic, here we saw in many countries actually ageism to the benefit of older people. So many countries, but not all, prioritize the vaccination first and foremost to older people. What we were looking at here is actually a newspaper article that was published on December 1st, 2020 in the New York Times. This was the first time that the United States kind of stated the priorities for vaccination. And we wanted to see what lay people think about this prioritization and how people frame old age within this context of very scarce resources related to the vaccine. So we look at people's comments and classify them. What we found was that people were thinking about the prioritization of the vaccine on two axes, on the social contribution versus vulnerability axis. And that's how they thought that the priority should be given. And I'm going to give an example first of a social contribution and then of a vulnerability. For social contribution, you see the first part. This is why my parents deserve to be first, so that they can enjoy their very limited number of years left to live. My parents have sacrificed their lives for me and my sister. The second example is for vulnerability. President Biden needs to be first. He's very old and frail, and then someone cynically replied, if he makes it that long without breaking a hip. Based on this division of individual in terms of their social contribution versus vulnerability, we classified three groups of older people that were discussed in these commentaries. The first group is that of long-term care residents, who were identified as being highly vulnerable, yet not contributing much to society. The second group was that of older people who actually work. They were both vulnerable because of their exposure or possible exposure, and also were thought of as contributing to society. And the third group was that of retirees. These are people who can self-isolate, thus they are less vulnerable, though they probably had contributed in the past to society. To sum up these findings, we noticed a lot of ageism and self-ageism in this discourse, and many older people were saying, I've already lived my life, now it's time for others, I don't want this vaccine, I don't need this vaccine. Same goes also for other people, for younger people, saying older people should not take the vaccine, it should be actually first healthcare workers and so forth. I think that also it became very clear to us that these lay people who responded to the newspaper article held a very neoliberal framework, which I think is very common in the United States and goes in line with the successful aging model. So priority for the vaccination was determined based on people's contribution to society, to the economy. This is certainly not the case in other countries necessarily. I'm going to conclude by saying that certainly I think the pandemic has proved to all of us eventually that we are all in this together. And that's something that we have to keep in mind for the future with an optimistic outlook to life after the pandemic. Susceptibility does not equal vulnerability, and we had to learn how to change our discourse around that, to communicate the risk, but also to ensure that people do not become ageist or do not split between populations simply based on age. I also would like to note that there are certainly multiple incidents of intergenerational solidarity that took place during the pandemic. I have not discussed those because of I haven't really no time. A pandemic is not a reason for human rights violation, and unfortunately it has happened over and over, especially with regard to the people who do not have the power to fight for the rights. I also would like to say that I believe we should not throw away the baby with the water, so we should not abolish all long-term care settings, but we do have to fight to ensure that people receive long-term care services that are adequate and respect their rights and respect their autonomy and free will. I'm going to conclude actually with the WHO slogan again, a word for all ages. And I am very optimistic. Today is the launch of the WHO campaign, and I hope that actually this pandemic that has done quite a lot of damage, I think, with regard to older people, might also make a change in our discourse and our thinking, and will prepare us to a new word, a word for all ages. I think we have time to get there, but I'm optimistic. Thank you very much.
Thank you very much, Liat. Great presentation, very comprehensive, and very focused on those areas as well. So appreciate that. I'm going to try and put my slides up since I'm next. Just give me 2 seconds. There, how's that? Is that working for everyone?
Yep, that's perfect.
Okay, good. Okay, I'm just going to minimize my screen. Okay, good. Well, thank you so much. And thanks to Benedict and Rianne and CMPA for inviting us to be part of this. I'm going to add just one word to the title of this webinar, and I'm going to add the word financial costs of ageism as well, because I want to highlight that in my talk today. Okay, so let's, my focus today will be on healthcare and the importance of having good mental health and physical health to optimize our quality of life. The Mental Health Commission of Canada's saying, and other people saying, is that mental health is fundamental to health, and there is no health without good mental health. So it comes as a package, and I always talk to my students and residents, or whoever will listen to me, not to forget about the part of the body called the neck, because the head and body are connected via the neck. So we'll come back to this principle later on.
Karen,
Karen, I just want
to know if you wanted to share your video during your presentation.
I'm going to leave it off just to keep it simple. Is that okay?
That's fine. Just wanted to ask.
Good. All right. Thank you. Just in terms of the cost, in October 2020, the amount of health-related funding that was announced by the federal, provincial, and territorial levels of government amounted to over $29 billion in Canada alone. And in 2019, the total health expenditure in Canada was expected to reach $265.5 billion, which amounts to over $7,000 per person, and that's 11.5% of Canada's gross domestic product. I would say to you, for consideration, is that we are a first world country in this world, and what we spend on healthcare is not peanuts. And yet my proposal to you is that I don't think we get our money's worth, certainly not during the pandemic and probably before, and certainly not as an older person. We'll come back to that in a few minutes. So I want to start a journey about how we see our own lives and how we see our own future. This is how we want to we envision how we will be when we're 80 or 90 years of age. We have three things that we need. We need a good place to live, something useful or purposeful to do, and someone to love and be relatively healthy. But not everyone is this lucky. And sometimes what you see in a picture like this is not what's really going on in your homes or in terms of your physical or mental health. And I want to take you through a little bit of a journey and then bring you back to ageism. So, there's an old saying that says getting old is not for the faint-hearted. And we've heard so much about ageism today, but let me ask you a question. You don't have to, obviously, I pretend you're all in the room with me today. How many of you know someone who is 90 or even older who functions at the age of maybe they function like a 50-year-old or 60-year-old? And the second part of my question to you to consider, how many people know someone who is 40 or 50 who are functioning at a much older age? So it's not about the number, it's not about the age, it's about the level of functioning, both physical and mental and social functioning. And normal aging is not a homogeneous process. Everyone goes through life between the ages of 18 and 65. We more or less function at a reasonable rate unless you're very unhealthy. But things begin to change when you get older. And as you get older, there are certain stresses that start to affect us differently. So the most important one here is physical illness. It's correlated, physical illness or a change in physical health is the #1 correlation between, it bridges the stressor to anxiety and depression and this cascade, the downward cascade that I'll talk to you about. Things included as part of this is having surgery, being immobilized, losing your sense of hearing or vision, social isolation, and this has become much, much bigger during the pandemic, but it's always been a big risk factor as people start to age. You go through social and economic changes, you go through psychological changes, you start to lose people who are close to you, your spouses, your family members, and retirement is also, or can be, a major stressor, although it's lower down on the list of importance. And on the top left corner is the stressors we just talked about, okay? And often this leads people to having some physical changes, which are often people lose sleep. As they get older, they start to have difficulties with their bodies, so they start to have some pain. Often their energy levels low. Often their concentration is poor. They don't eat well. They don't look after themselves. And this is connected with the way they think about it. And I think Elena started her talk today by saying the way you think, the way you feel, and the way you behave is what drives our longevity. So if you have negative thoughts about yourself, you have poor self-esteem, pretty soon you start to behave in those same ways that are congruent, and you start to withdraw even more. You become less productive, and you become more withdrawn and socially isolated. So this is the vicious circle. And as you get into the spiral, we know that people who are asymptomatic have a very high level of functioning, asymptomatic in terms of having anxiety or depression, but people who have more symptoms, subsyndromal symptoms or minor or major symptoms, the level of functioning is much, much lower. Now, we often find, I work in an acute care hospital, but this happens in long-term care homes. It happens to people who live at home. Once people get into this kind of funky physical and social and psychological frame of mind, it becomes very complex. And we call that, comorbidity, or having all 3 or 4 layers superimposed on each other, becomes very problematic. Often these older people don't have access to care. There's 1 out of 4 people in Canada have no available relatives to them. Okay, they often, even if they do, they don't want to seek help for many of the reasons that Leah talked about. They don't want to seek help, and often they're not able to follow through on the treatment plan. They don't, like, I'll ask you this question. If you're given a 10-day course of antibiotics, how many of you take it religiously for the way you're supposed to? Now imagine if you're 80 years old, you can't see or hear well, sometimes your concentration is not good, and you forget. So all of these things come together to cause this downward spiral that we call generalized failure to thrive. And this is before the pandemic. I'm talking about just general aging process. We know that this increases the risk of depression, but depression is very common, but it also has physical consequences. There is a much higher rate of coronary artery disease, heart attacks, strokes, and dementia if you suffer from depression. Often it's not as clear as we'd like it to be. People just present with all these symptoms. They're frustrated. There's conflict going on in the family. And, physicians or clinicians don't have the ability to tease this apart, whether it's normal grief that people go through, is it due to a medical condition, or is it a side effect of the medication? And the list is much longer. I just presented you with 3 or 4 things here. Okay, so let's come to COVID-19. So everything I've said so far applies to older people who weren't before the pandemic. We know that COVID-19 amplifies the risk of death. The case fatality ratio is 7 to 10 times greater as you get older. We've also managed successfully to isolate our older people, and loneliness itself and social isolation is a toxic killer. I can talk about that for a much longer time, but it does affect your mortality as well. So there's a double pandemic here of ageism and COVID-19, as well as social isolation and loneliness. People who are isolated are afraid of the disease, they're worried about infecting other people, and they're also not getting adequate care or vaccines that Leah just talked about. Underlying this is not, remember how much money we spend on healthcare? This is not about resources. This is about problematic policies, underlying ageist attitudes, people being made to feel disvalued and expendable, with severe detrimental effects on their physical and mental health. People's self-perception is that they begin to believe that they're not worthwhile, and they start to feel depressed and lonely and anxious and isolated. And this affects their physical and mental health. And there's biological, but also psychosocial mechanisms that underlie this phenotypic expression. And often we've seen people come into the hospital every single day in their depths of depression, often with medical and physical problems, and they're often feeling that they'd rather be dead than be alive. Some of them have even asked for medical assistance in dying. Okay, so I want to just shift gears a little bit now and talk about the negative health impact of ageism. The data that we have now are so unequivocal. This is a 2020 meta-analysis showing that ageism was present in 96% of the studies that were studied here. And internalizing the negative representations of the person's old age leads to a much higher prevalence of psychiatric conditions. Secondly, a big systematic review in 2020 with over 7 million participants that looked at 13,000 published papers and 422 studies that were analyzed showed that ageism is linked to much worse health outcomes in 95.5% of the studies looked at. And this was done in 45 countries in 11 of the most expensive and most common health conditions over a 25-year period. So the data is just, we've got mountains of evidence now that this is real. It's not just someone coming up with ideas themselves. It's, in other words, it's not fake news. Disproportionately, older people are not represented in clinical trials, including vaccination trials or medication trials. We know that 6.3 million cases of older people have experienced depression globally, attributed to simply ageism. Okay, I'm just going to turn quickly to the financial cost of this phenomenon. Ageism in the US, and this was a study done of people over the age of 60, only in 1 year, this is just within 1 year, the amplification of costs related to the prevalence of health conditions were as follows. 17 million cases of health conditions were due to ageism. The highest cost associated with this was heart disease, cardiovascular. It was calculated to be $63 billion in 1 year, which is about one for every $7 spent on the 8 most expensive health conditions studied were due to ageism. And if you even reduce this by 10% in terms of prevalence, this could save 1.7 million fewer cases of health conditions that we'd have to deal with. So there's a clear business case that needs to be made to our policymakers and governments and healthcare providers that this is real. So reducing ageism will improve healthcare costs and also for people who are living this horrible nightmare that ageism brings to us. One of the main solutions, this is a segue for the next two speakers, is we need a United Nations Convention on the Rights of Older People. This is a slogan of GARUP, the Age with Rights, and I'm going to pass the mic in a minute to Margaret Young. ILC is very much part of this, as is GARUP. The websites are listed there. I would really encourage you to look at the websites and follow some of the recommendations. Talk to your politicians, talk to everybody that you can about this, because this is an important thing to address at this point in time. So I thank you very much for your attention, and I will pass the mic to Margaret Young. Margaret.
Okay, my mic is mute. I don't have any slides. What I'm going to do is going to talk through what's been discussed so far. We've had guest speakers who very clearly showed the impact of ageism, and it's wonderful that Alana and Banya shared with us in terms of both the current state on ageism as well as the toolkit that's available. When we look at underneath, like the ageism, the social behavior, the policies that Kieran was talking about, the financial cost impact, what underpins it all, it's really around human rights. And the reason is that our human rights define what we as human race will commit to, what our governments will actually protect, enforce, and fulfill, and gets into legislation. So just a little bit of a quick segue before I get into kind of the meat of the couple of topics which will illustrate the point. So currently we have conventions for the child, for women, and for people with disability, and a variety of other needs that's universally recognized. So what that means is that governments or member states across the world say, we recognize these human rights, we're going to bring it back to our country, and with our country, we will develop and ratify these conventions and develop the legislation that's needed for our country. So case in point, the most recently, I believe it was December, we heard about like Bill C-51, which is really all around indigenous rights of the nation, or the First Nations, the Métis, and our group, First Nations people. So there's been great work all along the way, much work on reconciliation and on rights. And what happened is with the International Convention at the global level, it provided even more perspectives and bench strength to help surface the issues that need to be addressed, so that within Canada, we can talk about it and actually then create a bill that's needed for what's needed in Canada. The forum for it to come together for a convention for older people, it's called the Open-Ended Working Group on Aging. It meets once a year. We didn't meet last year because of the COVID. This year we're meeting, and it'll be on the week of March 29th. So there's a lot of discussion globally around rights of older persons. The talk of, like, let's draft the convention. COVID has shown us, what's going on. And within the session, there are two topics that I wanted to bring forward as illustration today. One is the right to work for access to labor force for the older person. And the second is lifelong learning. And in terms of lifelong learning, I'll touch upon digital literacy and digital inclusion, which is very much a hot topic in Canada. So in terms of right to work, what the first step is, for the assembly, before we get together, statements are gathered globally, and we share, like, from different countries, what are the key issues relative to the topic. And on the topic of right to work for older persons, ageism, or age discrimination in the form of discriminatory treatment at work, hiring practices, promotion, personal development, mandatory retirement age, it's almost universal in different forms based on all the feedback from the country. And when we look specifically, Canada actually made a submission. When we look at what we've been doing so far, we're actually not too bad. We're in the middle of the pack. So we have a Accessibility Act that was created in 2019 that talks about accessibility, so that for older person who, later life stage, there's disability issue, there's more of that support. There is programs within Canada around skill boosting for rehiring workers who've been displaced, to gain some skills to retool. There is a basic literacy and essential skills program, which has a small component around digital literacy. The Canada Labor Code was amended in 2017 to apply more flexibility at the workplace in terms of work arrangements, medical leaves, and then paid and unpaid personal leave. So for the older person, what that means, there's a bit more support around, like, caregiving that needs to happen. In terms of recruitment and jobs, at the National Job Bank, there's actually a National Job Bank. There's now a filter for seniors when it comes to work, so that as employers, post the jobs, if it's a job that is applicable, like in terms of the skill sets or the abilities of a seniors, it's also clicked and apply. So that's good news. Late in 2011, federal government went through different federal provisions and removed mandatory retirement from most of the federal laws. So that is really a very good step in ahead of other countries who have not done that. On the flip side, Canada also submitted what is not working relative to the older workers, and the right to work within Canada. The number one thing was ageism in the workplace. And specifically, it says that it's identified by the federal government as well as the provincial and territorial governments as a challenge. So it's recognized that ageism exists, age discrimination exists, and it's something that we still need to work on within Canada. And the key things that were highlighted were hiring practices, disadvantages when it comes to the intersection between ageism and disability, as well as lack of training for reskilling and recreditation, if a accreditation expires. Inability to match jobs, even though I talked a bit about earlier about the National Job Bank, more work need to be done in terms of matching jobs for seniors in terms of the skills and abilities. And there's currently also a disconnect or a disincentive. If someone is receiving a pension, it might not be as advantageous to work because it can then theoretically like bump them up to the next tax category. So that's another barrier. And also in terms of the increasing family responsibilities such as caregivers. So while Canada is making progress, we still have lots of work to do on the issue of older person or older workers, age discrimination and access to work. And that's very significant because when we look at our lifespan, we are living longer and longer. So while this first cohort of older persons, in our 60s, 70s, and 80s, and yes, there are people who are working, needs to continue to work, they need that support, right, in terms of being able to make that run rate. In Canada, there's no specific right to work provision within the Charter of Rights of Canada. There is, though, very good news. There's an equality to rights section that prohibits age discrimination, but as we said, that's still happening. So a couple of examples of what's happening in other parts of the world in terms of practices. For example, in Korea, age discrimination is prohibited within the workplace. So when that happens, someone can actually file a complaint, go through the review process. If it's deemed that through the review process that discrimination did happen, then the company needs to ratify or rectify what's going on. If the company does not take steps to rectify the situation, then penalties from the government will be enforced. So it's just one aspect. In Japan and Singapore, where the aging cohort, they're actually getting into super agers. The 65 plus or 55 plus population is actually growing much bigger or faster than us in Canada. 83% of or more of the companies have started to adopt continued employment. So meaning they have a certain targeted retirement age, be it 60, 65. But what's legislated is that there's an extension to continue employment, and the target into 2030 in Singapore is actually up to age 70. So that's just an illustration of the point again that the right to work is a reality for all of us in terms of be it the economic means or self-fulfillment in terms of purpose. So what to do about that? And really, it's while we work hard at the policies level, or as NGOs work on the programs, it really goes back to the rights of older person. It really does, and that then links to the convention and the work that needs to be done. And this is the same case for digital literacy in Canada. And I'll just touch on that quickly because my time is going to run out soon. Digital literacy through the COVID time period has gained a lot of good attention. Like there's a lot of great work that's being done by NGOs. Like I've spoken to a couple of NGOs in Canada that focus on specifically on digital literacy for older person. There's GLUU, GLUU, that's in Victoria, in British Columbia. There's Connected Canadians in Ottawa, Ontario. These two organizations focus on digital literacy for older person even before the COVID. That is their passion. So when I chat with them, they said that, through the time of COVID, they were getting calls through the phone, like from older people saying, can you help me? I need to now learn some skills so that I can get connected, so that I can, video chat with somebody. And so it really, that then, we step back for a moment and think about ageism. It counters ageism, because when it comes to digital technology, digital literacy, the most common ageism that's external, right? The environment say, well, older people they don't like technology. They don't want to learn. And then the other one, internal ageism, is that, oh, as an older person, I don't want to learn. It's too hard to learn. But through COVID, we see that's not true, that we see that break in that kind of ageism. Even with AgeWell, SFU University, AgeWell, they did a quick survey with the people that they work with. And what they found is that through the COVID time period, 23% of Canadians aged 65 and older are starting to use a smartphone to do video call, to reach out to friends and family and whatnot, or participate in the church sessions on Sunday. And that's twice as many as in 2019. Also, the other one, e-commerce. We thought, oh, e-commerce, shopping online. There's also a rise. 19% of Canadians aged 65 and older are starting to use, because of COVID, use technology to purchase their essentials. So that really shifts the paradigm of ageism and what needs to be and can be done. So the question then is, okay, well, where does human rights come in for this particular topic of digital literacy? Where it comes in is that while we have lots of good intention, lots of programs, and aside from the two organizations I mentioned earlier, there's associations across Canada that's, putting the work and working hard and very like, how do we get devices? How do we get like cheaper access to Wi-Fi? How do we bring digital literacy? There's not a coordinated way to say, what is the learning, the lifelong learning that's needed for an older person? Meaning for an older person to learn how to apply digital literacy, what's important to them. There's not been that kind of look and deep dive into it. So the opportunity is really to look at a convention for the rights of older person, where within the lifelong learning, there's a discussion about accessibility. There's a discussion about adaptability, meaning adapting it to the individual needs. And that could be both the accessibility component, right? As well as the cultural component, because that could be different. And some people might want to use a phone, and some people might want to use a tablet. So all those different kind of guiding principles are within within the possibility because of the work that's being done. So I'll just kind of quickly wrap up by saying, highlighting what is it that you and I can do, or for everyone can do. I think the first is really to join the Age of Rights campaign. As you see in my background, it's an orange red, it's bright, it's shouting out loud, Age of Rights. The Age of Rights campaign slogan is a work of the Garrett members, and the members are actually all NGOs, and our Canadian Network Prevention for Elder Abuse is one of our members, yay. And it's very deliberate. It says age with rights. It means that as we get older, into our older age and later life course, we have rights, we're rights holders. So governments need to listen and respect and support and fulfill and enforce those rights. And then secondly, there are, so join the campaign. It's actually very easy to do. There's different opportunities to participate. The website is www.rightsofolderpeople.org. There'll be a slide at the end that kind of shows, how to access that. If you have, even as you kind of develop your interest, you might say, well, I want to know a bit more about rights of older people. Also check out Help Age International, NGO committees on aging. These are our sister NGOs that have lots of good information, and also join Garrett if you're to extend that. So with that, I'll pass it over to Kieran or our next speaker. Thank you.
Great, Margaret, thank you. I know that we're probably going to run out of time very soon, but I would love for Margaret Gillis to have the final say, and hopefully we'll have a few minutes left to do some questions and answers. Margaret?
Thank you so much, Kieran. What a great discussion today, and it was really exciting to have the World Health Organization speakers. In discussing her 2020 report, Dr. Theresa Tam, Canada's Chief Public Health Officer of Canada, said the tragedy and massive lesson from COVID-19 learned by everyone in Canada is that we were, at every level, not able to protect our seniors, particularly those in long-term care. Even worse, she goes on, is that in the second wave, we warned of the resurgence, and then there was a repeat of the huge impact on the older population again. Now, having listened to the experts today on ageism and the words of Dr. Tam, you might want to ask yourself the following questions. Why weren't we able to protect those in long-term care in the first wave, and even more disgracefully, in the second wave? How is it that despite knowing for decades about the underfunding and neglect of long-term care, and despite thousands of pages of reports over the same time period, we had a system so incapable of handling a crisis that the Canadian military had to go in to help save frail and sick older persons? How could it be in phase 2 of the pandemic that the same thing happened as in phase 1? For instance, there are 70 people who died at the Roberta home in Barrie, Ontario, to name just one case. Now, do you think that would have been allowed had it happened in some other Canadian institution, like a school or a university dorm or daycare? Well, of course not. And yet it was allowed to happen twice, and possibly, hopefully with vaccines, not a third time in long-term care. Now, our excellent speakers have set out a clear answer. Ageism and age discrimination in all its ugly and vicious forms is evident in Canada and globally. Ageism prevails in long-term care, in the rise of elder abuse, in the healthcare system, in employment, and in access to technology. We also know that ageism negatively affects the mental health of older people. So what should we do? Well, we need to confront ageism in all its forms. We need to recognize it in others and stop it. We need to recognize it in institutions and stop it. And we need to recognize it in ourselves and stop it. We need continual and evidence-based campaigns, such as the ones started today by the United Nations and WHO, to expose and destroy ageism. Now, we at International Longevity Centre Canada have been working to eliminate ageism through our activism. First, in spreading the messages through meetings and speaking with Canadians, such as today's webinar, and with strong partners like the Canadian Network for the Prevention of Elder Abuse and Elder Abuse Prevention Ontario and Age Knowable, just to name a few, and through our work at the United Nations to fight, and I do mean fight, for the rights of older persons by pushing to have older persons' issues addressed at all the major UN institutions, and by activism to get a United Nations Convention on the rights of older persons. So just quickly, why do we need a convention? Well, first of all, because older people are being denied their human rights across all the globe, as COVID has so clearly shown and has been illustrated by our speakers. Because older people are subjugated to ageism and discrimination, because the UN conventions currently in place do not cover older persons and they do not cover ageism. Because conventions work, and conventions can transform older persons' lives by assisting governments to address aging positively by generating financial and other resources for programs and interventions to help older people, to properly fund long-term care, for example. And finally, because the convention is a tool to enshrine human rights and end violations through a legally binding instrument. Now, International Longevity Centre Canada wants to thank many of you who, since our last CNPEA and EAPO webinar, have written to the Ministers of Global Affairs and of Seniors calling for a convention. We hope that if you have not done so, that you will go to our website, ilccanada.org, and send your support for a convention after this session. And since we last met, we have seen movement by the Government of Canada to be more open to discussing older persons' rights. Kieran and I have met with officials from Global Affairs, from the Minister of Seniors Office, and Economic and Social Development Canada. And we have been in discussions with the Canadian Mission in Geneva to bring to have Canada bring the rights of older persons to the Human Rights Council. Our next move is to hold an official United Nations event at the annual United Nations meeting on older persons, which Margaret Young referred to. It's called the Open-Ended Working Group on Aging. It's your chance, due to the fact that this year's event is virtual, to experience the United Nations in action on aging issues. The event that is hosted by ILC Canada is scheduled for March 30th from 1:15 to 2:45, and we'll have it translated in French, Spanish, and American Sign Language. So please, again, go to ilccanada.org and sign up. We have an epic lineup of speakers, including Ambassador Bob Rae, who's a human rights advocate in his own right, Senator Patricia Bovey, the first official in the Canadian government to support the United Nations Convention on the Rights of Older Persons, on the floor of our Senate, and Dr. Ann Collins, the president of the Canadian Medical Association, who has supported us, an organization that supported us at the UN since 2015. Our international speakers are also impressive. Ambassador Squef of Argentina, who's the chair of the Open-Ended Working Group on Aging, Ambassador Halil of Morocco, who along with Canada helped get 148 signatures of United Nations member states on the Secretary General's really important report on policy and programming. We also have Dr. Alex Kalashi, formerly from the World Health Organization. He's now the president of ILC Brazil, and he'll be telling us about the horrific conditions that older people are experiencing in Brazil during this pandemic and making a call again for a convention. We ask you to fight ageism by supporting the World Health Organization's campaign and to work with the Canadian Network of Prevention of Elder Abuse Prevention Ontario, and the International Longevity Centre of Canada. Help us fight discrimination and ageism. Age with Rights is our slogan. Be a part of it and make it happen. Thank you.
Thank you very much, Margaret. I think we are still okay for a few minutes for some questions. Maybe you can all turn on your cameras if you wish. The panelists, that would be great. And I see, I'll just make a quick comment and then we'll go to the questions. I see a lot of questions and comments about the horrific and flagrant violations of human rights of individuals, people who have been touched by the violations in home care settings, in long-term care settings, in acute care hospital settings, and they have to do with all kinds of things, not being fed, not being toileted, being over-medicated, restrained, the families not being given enough attention or even information, let alone attention. And, you know, and we deal with this every day. Like I see it every day in my life. And one thing I would like to tell you is the only way to address this, it's not about resources. We put a lot of money and resources into our system, but it's about lack of standards and it's about lack of enforcement of those standards. And the only way to get those done is through a convention on the rights of older people at the United Nations. So please, 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 I urge you that your call of action is to actually in Canada, write to your MP and MPP, go to the ILC website and send in your letters. You just have to sign it and send it in. And at the United Nations, support our work at the Open-Ended Working Group. So I'll just leave it at that as a preamble, because it's really, it's almost sickening to read some of the things that I'm reading on the chat. It's really quite amazing. So please do that. It's not possible to address every single violation individually. Let's do this so we never have to worry about human rights violations for older people, and the convention is the answer. Okay. Benedict, are all the questions just on the Q&A or are they on the chat as well?
So they're kind of spread between the chat box and the Q&A, and I've been trying to gather them in one spot
Okay.
to make our lives a little bit easier. So there were a lot of, as you said, Kieran,
Yeah.
a lot of heart-wrenching testimonies in the chat box, a lot of comments, lots of them very relevant.
Oh.
But I have only a few questions for you so far, and I'm sure we have a few more coming in the next few minutes. There was one question that I saw, which was related to the healthcare costs and related to health conditions. The one person said the two highest healthcare costs relate to smoking and alcohol use in Canada. And does the World Health Organization or anyone in Canada endorse low risk drinking guidelines for older adults or smoking cessation? Is there any specifically targeted campaign that addresses this issue so far?
Can I take a quick stab at that? So,
Sure.
so Marilyn, thank you for the question. I know Marilyn well, and she and I have done a lot of work together. My understanding is that there are some recommendations, but they're not specific for older adults or older persons. They're just general recommendations for adults in general. So I could be wrong, and perhaps we need to verify that, but that's my understanding. And your point is a really good one. Back to you, Benedict.
Another question from Olive in PEI. She is asking, how can we, as ordinary citizens, start a groundswell? Because the negative impact of ageism is clear. And so what can individuals do to start that wave, to kickstart this?
Let's start with you, Margaret Gillis, and then Margaret Young, if you don't mind, with since we're talking Canada here, right? So.
Sure. First of all, it would be great if you supported the call for the convention, because what the convention does is give us the opportunity to make sure that government actually makes changes. And a convention would actually talk about addressing ageism. I really believe one of the things we need to do in Canada is really push for an anti-ageism movement, and we need funding from the government for that. And we need to really make the issue of ageism come alive. It is such a buried ism. And unless we push to do that, I think we'll still be having this conversation in 5 years or 10 years. So push for that. So I would be one thing I would suggest you do.
Margaret Young.
I think there's a couple opportunities. So first, the Age of Rights campaign, there's a social media type of support, so that when you're talking issues that, such as the ones that you've kind of highlighted, tag it with the Age of Rights, and be very visible in terms of supporting this particular movement about rights for older people. Start to have conversations locally. We started in BC with a group of older persons about what's important and what does rights mean to them, and start creating those dialogue. It's really dialogue. We can start with older person, and it could be intergenerational. That's what's going to help with both ageism and this whole rights movement. Thirdly, for organizations that are accredited as part of the open-ended working group, there's actually a video campaign. So the video campaign is like and it doesn't actually, it doesn't have to be accredited. It's actually a 2-minute video campaign that's, you can just get on a phone, the phone, be it a phone or be it a Zoom kind of platform, and say, what's important to you that needs to be heard about older person and rights of older persons. Within that campaign page that we talk about, there's also access to how to get to the video, and that can be part of how you can get your voices out. We are at GARA promoting these videos as part of our social media during the week that Margaret Gillis mentioned. So it'd be really great if we have more videos from your voices on what's important. So I think those are some of the different ways, and I'm sure there'll be others moving forward, but I think those would be great ideas to start with.
Thank you, Margaret. Kieran, I think you wanted to ask another question.
There was a question on the chat, and I wanted to direct this to Liat. Liat, here in Canada at least, and you're bringing the sort of the international perspective, so really curious to know what you think. The issues in long-term care mostly are a result of for-profit businesses, and the major disconnect between government regulations or lack thereof. Any business whose business is to care for health and well-being of people have to be held accountable, and governments must take responsibility to ensure policy and practice including investigating, auditing on a regular basis. Can you reflect on that in terms of global perspectives and what your personal thoughts are? Thanks, Leah.
Sure, I totally agree with what you're saying. And as you were saying, we wouldn't have, or I think Margaret Gillis was saying, we wouldn't have allowed the same approach towards schools or other institutes. But with long-term care, we kind of threw this entire system away from the responsibility of the government back to the responsibility of private organizations. And I think this is why they have failed, because they have been neglected for decades all over the world. And now during the pandemic, this has become noticeable. So I totally agree with you. I can say that in Israel, actually, right now with the vaccination, we were doing well just because the healthcare system has not been completely privatized yet. Had it been privatized, we probably wouldn't have been able to go through this vaccination operation. So yes, there are things that need to be under the control of the government, and long-term care is certainly one of them, because this is a human right and it has to be provided to all in an adequate manner.
Thank you, Leah. Back to you, Benedict. I think you're on mute, dear.
My bad. I had to do it at least once today. Before I get to another question, somebody made a comment saying that the Guelph Wellington drug strategy has developed an information sheet for older adults about the use of alcohol and other substances. So I will try to find it and send put the link in the chat box before the end of this conversation, as that could be very interesting. One question was, yes, sorry, go ahead.
No, I was just going to put a plug in here, if you,
yes.
For the Canadian Coalition for Seniors Mental Health, the CCSMH. We published 4 sets of guidelines last year on substance use disorders in older adults for alcohol, cannabis, benzodiazepines, and opioids. So look, ccsmh.ca. They're free. Have a look.
Thank you. I will add that to the list of resources. It was more of a comment than a question, but it nonetheless bears mentioning. Margaret Young, I think that might be for you. Somebody pointed out, we must remember that not every person, especially every older adult, can afford technology. So how do we help bridge that gap and ensure that more people have access to the right tools?
Yes, it's a great question. So some of the things that I think we might see happening already is some of the programs that are being piloted within different provinces around digital inclusion. So aside from the literacy aspect, there have been pilots in terms of donations from TELUS or Best Buys around the actual either tablets, they're mostly tablets because that's the best form. I think TELUS donated also Wi-Fi cards with certain amount of limits. So those things are kind of pushing the envelope in terms of what needs to be done on policy and program. In terms of that access piece, the whole thing about information, computer technology, ICT. I'm actually working with some folks around a public policy around digital literacy. So if anyone wants to provide more feedback or comments on that, we would love to hear so that we can look at how that could be, included around that. Hopefully that helps.
It does. Thank you. I wanted to ask a few more questions, but unfortunately, we're already kind of past the end time of our webinar. So, Ran, I will let you take over from now for the last few comments. Oh, and you're muted just like I was.
I do want to thank all the speakers again for sharing their knowledge and expertise today, and for Leah to join us from far away to share her the work that she's been doing as well. I just want to show just a few slides of that was referred to by our speakers. The movement that Margaret Young was referring to, this is the website, rightsofolderadults.org. You can find more information around that campaign. And again, that call to action that Margaret Gillis was referring to, if you go to the ILC website, letters are pre-made. You just have to use them and forward them on. It's a pretty simple process, and we have been having good uptake in terms of people within Ontario. I know that have been forwarding that on. And then there's just the flyer that was mentioned about the upcoming event that's being held on the 30th. The link is there. We can send that out again to individuals so they know if they want to participate in that, so they know how to access the webinar. We have gone through our questions. Just a slide just indicating that both of our organizations are nonprofit, and we do host all these webinars, provide availability and access to everyone. If anyone would like to donate to either of our organizations, you can go onto our websites, and there is a donate page as well. And there's a wealth of information and resources on both of our sites. We do regular newsletters to keep everybody apprised of what's going on in our communities on a monthly basis as well, and many resources that's available for people to download and access. Just the contact information for all of our speakers today, including our guests from the World Health Organization. If you wanted to access that and the report, we'll put on a link onto the website. As a reminder, the information will be posted within a couple of days onto both of our websites with links, including the video and the PDF presentation from today's session. If you want to connect with either Benedict and I, there's our contact information that you can either email us, which is the quickest way to get response for any questions that you might have. And I know there was some follow-up for situations that I know Benedict reached out to a few people today through the chat box. So we will follow up in the next few days with you in regarding that as well. So just as a reminder, there will be a quick evaluation pop up after the screen. If you wouldn't mind just taking a couple minutes and finishing that would be really great to have your feedback on today's session. And we thank you for participating, and we look forward to your involvement in further presentations. We do have another webinar scheduled for next Thursday on capacity, with a panel also of experts that will be speaking on capacity from a community perspective, assisting older adults, maybe in sort of complex situations, using a case study to run through sort of roles and responsibilities of different sectors, including a geriatric psychiatrist, our home care associate, a seniors at risk coordinator. So it should be a really good interactive discussion as well. So thank you again for participating. Again, thank you all our panel members, for Kieran for moderating today. And we look forward to your further engagement. And again, we do apologize for the IT issues at the beginning of the presentation today.